Good day, everyone. Good day. I'm so glad to be here, and I'm so glad to have a special guest with us. I want to thank you for joining this event of the Black Doula Consortium. My name is Audra Jones. I'm a BDC, that's our acronym, partner, host, and facilitator of many of our events. I'm also a public health professional, maternal and infant health advocate, a mother, a daughter, sister, grandmother, mentor, and friend that can consistently be found doing work within our community to advocate for equity in healthcare and services for many of our underserved people, locally, statewide, and nationally, especially the Black family. Just to give you a little quick background or backdrop on the Black Doula Consortium, it's an initiative we started in 2021, and it brought together community doula organizations from Northern and Southern California and from the Central Valley in an effort to strengthen California's Black Health Equity Network, providing resources to doulas and birthing persons, raising awareness of health inequities, and listening to Black voices. Last year, over the course of 7 months, June through December of 2021, the consortium developed 7 online webinars, events focusing on maternal health topics that are greatly relevant to California's Black birthing community. Some of our topics included maternal mental health, preterm birth, and infant loss, and stories from mothers. So we encourage you to visit the website of Black Wellness and Prosperity Center, www.blackwpc.org, to learn more about the consortium and check out the previous events. With this, we cannot have done without the support of Blue Shield of California. We'd also like to thank our partners, Black Wellness and Prosperity Center, Diversity Uplifts, Inc., and Frontline Doulas, as well as myself, kicking off the second phase of our work, or the second year. And so we're looking forward to more. But today, I want to thank you all for joining, because on today, I have the great pleasure of introducing and bringing forth to the table a special colleague and friend who has been involved in this work. And I'm really excited to really bring her here and have some dialogue with her and you all in regards to her work at the organization. I'll wait till she shares who she's with and what she's doing. And today we're going to be talking about some of the work they've done for Black birth workers in the form of a business toolkit. So without further ado, I'd like to introduce you to my friend and colleague, just sister, amazing woman, Raena Granberry.
Thank you, Audra. Thank you, my sis. I'm super happy that you all allowed me into your space today. As she mentioned, I'm Raena Granberry. I've been involved in this work quite some time, and all starting from my own background of having some very traumatic birth experiences, and then going into working with the Black Women Health Program, as well as working at LA County Department of Public Health, in the AIM program with my sister Audra, at Black Women for Wellness, and now at the California Black Women's Health Project. And so at the California Black Women's Health Project, our maternal reproductive health program focuses mostly at this time around supporting birth workers and around creating support, training, advocacy for the workforce. Right now, you see so many people investing a lot in, we want to get all these doulas and we want to have these doula programs and lactation and all that. And that is wonderful. That's what people like, Audra and folks that have been in this for a long time have been fighting for. So we're happy about that. But a lot of people are just being thrown out there, and our sisters have, and others have passion in their hearts to do this. But we want them to always remember that if this is what you're doing and you're making money from this, it is a business. And in business, you need structure, you need boundaries, you need to know policies. And so we were able to connect with the California Healthcare Foundation, who actually gave us funding to come up with a toolkit that I'm gonna share with you today. And so typically when we do our toolkit trainings, they are about like a 3 to 4 hour training that we do. Yeah, we really break it down, but what I'm here today to do, I'm so honored and pleasure to do, is just kind of give you all a snapshot in it. And so I've left all the slides in the presentation. So sometimes you're going to see me just do a couple clicks through, because I want you all to still be able to see what information that we provide, even if we're not going to cover it today. That way, if you decide that you want to be a part of any of our training or full-length trainings in the future, we would love to have you. And just so you know, these trainings are provided to birth workers for free. There is not a fee for this. And it will also be available online.
Perfect. And before you get fully started in that, I think I want to make sure we're clear for folks in case you didn't hear it. Black birth workers, we're talking about midwives, we're talking about doulas, we're talking about community health workers, maternal mental health peer specialists, lactation consultants, birth educators, breastfeeding counselors, advocates, and activists around the work. So I'm going to step back so that Raena can have the floor and also share her slides, but we will be back for some in-depth conversation after you see this amazing presentation and this great work that the California Black Women's Health Project has put together for you, the Black birth workers and our community. Thank you.
Thank you. Okay. All right. Thank you so much. So as I mentioned, this is our Black birth workers business toolkit that we created again with our partner, the California Healthcare Foundation. So we can go ahead and move on to the next slide. This is just a, that's okay. Yeah, so the first thing that I do want to take a little time on is just to look at the birth code of conduct. We all know why we come to this work, what brings us here, but we also always have to center the person that we are supporting. So, you know, some of you may have been birth workers for a long time, and none of this is to, you know, offend or to make you feel as though you don't know what you're doing. We know you got this, but it's always good to just come back to basics and fundamentals and just remember very core things about how we want to support folks. And here is a birth worker code of conduct, and you will see all of the folks that we helped us create this in the end. But the birth worker code of conduct basically just talks about entering the space quietly and respecting the family, not talking or filling up space during contractions. You know, let these moments happen and let this be very peaceful, unless, of course, your client asks you something different. Never argue or debate with a birthing person or a mother. Folks have had stories about, you know, you may feel really strongly about a decision or about, you know, cesareans or about the golden hour or about lotus birth. But we never want to, all we want to do is inform, and you all know that. And then no is a complete sentence. Again, you know, we inform, we provide education and support. But no means no. And if, you know, his family makes a decision, the only thing we can do is share why we would have made a different one, if we even do that, and then just let that be it. And then always ask for consent. It doesn't matter how nice someone thinks you are or how long you may have known them. Things change from day to day. Triggers occur from moment to moment. We don't know when people may have experience something traumatic or just remember something traumatic. So we don't want to touch, get in spaces, or do things that are very personal without the consent. And we need that consent every time. Can I touch the baby? Can I touch you? Can I touch your stomach? Would you like some help there with the lactation? We always want to do that. Never abuse your authority. And even in the hospital setting, we are not there to create moments of contingency or anything that is uncomfortable. So we always want to, you know, use our discernment, stand in our strength and our knowledge without abusing our authority, and try not to have really casual conversations in the birthing space. This is our legacy. This is something that is ancestral. So we always want to really be in the space. Let it be personal. Let it be special, sacred. All of that, and not be kind of having side conversations. Maybe somebody called me on the phone, I carry on too long. We never want to do that. And then lastly, never to rush the birth. We just don't want to rush birth. We know why we don't want to rush birth, right? It's a natural process. It will do what it needs to do, and we are there to just push along. The next slide, we won't spend too much time on because it's just about defining your work. So most of us know the difference between midwives, doula, lactation, community health worker, et cetera. Sometimes we do need this for newer doulas or maybe even doulas who have been trained in different settings. Some more very grassroots community doulas, may have been trained that, they can deliver babies or catch babies. And we would never, people have their own practices and things, but if we're talking about business and we're talking about hospitals, which still the majority of our births are happening in hospitals, we have to remember to do things in line with, medical definitions. And those boundaries include that doulas are there for different needs and not those of delivering a baby as in the way that a midwife would. So next slide. So here again, I just wanted you all to see this. I'm not going to go deep into this because this is one of the things that really takes time. But what we will touch on is that if you are operating your doula service as a business, some people are doing it as a heart service and maybe they'll help out a sister or a cousin. But if you are depending, any portion of your finances, any portion of your income is depending on your doula, your midwifery, your lactation, your community health worker work around people who are giving birth, you have to really start thinking about business formations and having your legal documentation in order. So here you'll see we have like links to places where you can choose his business name. You may have had something on your heart before you carry on 20 years talking about, I'm Raena's birthing service. I need to go look on here and see, is there a Raena's birthing service? I don't want to receive a cease and desist. You want to be able to trademark your business, and that's here too. You have to register your business. There's a lot of taxes and fees that come along with having a business that you need to understand, especially in California. So we have a lot of that. And about talking about your tax and insurance requirements. We have a lot of doulas that are out here. We have a lot of different birth workers. Midwives typically always have the insurance in order, of course, because they're delivering babies. But even as other birth workers, you should have this insurance. And we break down here links to what you need to do to connect to those services. And again, we are a resource for you if you need this information. So we'll go on to the next slide. This is where we spend a little time in our longer sessions about your business description. People show up and they say, I'm a lactation specialist. I'm a prenatal yoga instructor. But sometimes you really want to break that down even for yourself. What does that mean? What all does your business do? Do you just show up, do yoga with clients, and then you're gone? Or is there other things that you do? Who exactly do you serve? Are you looking to do this as a passion project? And so you will need some maybe higher paying clients in order to, offset those services that you may provide for a population that is dear to your heart that can't cover these services. These are all the things you have to think of so that you're not just kind of thrown in there when you meet people and you don't have a plan around how you're going to serve them. And if your business is providing type of service, where will you be? How far are you willing to travel? If you do extra things, what are those fees? And that's really important. What does your client look like? A lot of times, we set out to do this work and we say, oh yeah, I'm helping out Black women and families. Well, what does that even mean? And do you have a specific experience that makes you special or that can set you apart or that is needed in our community? I use gender identity for a good example. If you are someone who may have some gender fluidity or something, you may want to specifically help that community, even within the Black community, because that is what is needed. That is something. We have older women who are giving birth, and they would love to hear the experiences of, if you're an older birth worker who actually had a child when you were in your 40s or 50s, that is a very specific need within our, so that's like a subset need within Black folks that are having babies. So just really think about that, because it does enhance your business to think more about who you actually want to serve. And is there a group that only you can serve or that you can serve better than others? This is a little bit back to what we were talking about again about products and services, right? So maybe I am a, newborn childbirth educator but I'm also a lactation specialist and I also do yoga. You know, let's line, maybe I don't want to do that for all my clients. Maybe I just have this one business and I'll have add-on fees, or I won't provide that at all. So just thinking about your different products and services. And like I said previously, what is your unique story that gives you something, a competitive advantage that only you can do? You know, for myself, sometimes I experience a stillbirth and a loss. That is a very tragic experience, but it is an experience of a lot of Black folks. And so that is something that people typically come to me for because they know I have that experience. And that is where you need to brand yourself and know what it is that you bring specifically. And that's what we're talking about here around the brand. When people think about brand, they typically see brand as like, you know, a clothing line or something that's on social media, or you're an influencer and like, what color palette do people know me for, or a logo? But branding is actually much deeper. Branding is who you are at your core values define what your brand is, because even if you don't have a website, you are a brand. I don't have a website, that's raenagranberry.com. But as I mentioned before, you know, I have stories out there. I've talked a lot. I had a lot of interviews. I do have a brand, and my personal brand is that I entered spaces and made myself an expert off of my lived experience. I don't have advanced degrees, but I've entered spaces saying, because of my experience as a Black woman who gave birth, received discriminatory care, and figured this all out for myself by connecting to resources and getting my education and advocacy, I have this specific expertise, and that is why you should come to me. That is my brand. And that is what we're asking birth workers to do. If this is going to be your business, really understand that. So you got to dig into your story. Why am I here? What makes me be a birth worker? What was the moment that the light bulb went off? That is what's going to touch people and make people connect to you and who you are. What inspired you to do this business? And when you do that, and when you take on a client, how can your values best support their experience? Because we're doing this for them, regardless of what it is that we're bringing. Next slide. And then the competitive analysis we talk about, we break down a little bit more. And typically when we do this in our training, we do a landscape analysis. And what a landscape analysis is to just look around you, see what other people are providing. And we don't do this competitive analysis in order to discourage you from doing whatever you want. So for example, we're not saying, you know, I'm a Black midwife and I want to open up a midwifery home, but there are 3 midwifery homes in my neighborhood, so I'm just going to give this up. Not necessarily. We're just saying, maybe you're willing to travel to the Antelope Valley with and open your midwifery home, since we've already got sisters doing that here. Or maybe you will focus on, you know, homeless shelters, or maybe we'll focus on doing visits with foster youth. Do a competitive analysis and see what products and services other birth workers are providing around you. How much are they charging for those services? How long have they been in the business? And you also can create your network that way. A lot of people in this work, like even including my sister Audra, when I came to her and others, I was able to talk to them. They've been in this work before me. They were able to help lift me and my leadership into another place, take me to another place from, you know, just the hands-on birth work into more advocacy, leadership, etc. And that was from me looking at, you know, who's around, tapping into the advice and what is there. So you want to do your competitive analysis, not just to figure out what it is that's around you and who do I have to compete with. We're not saying that, but who's around, who can be a resource, and how do I best serve my community by not duplicating resources? Or maybe I join in with one of those existing birthing houses. You know, that may help me not have to do as much research. Maybe they need help. Maybe they need more, you know, midwives to help them there. So that's the thing there. And then one really important thing is like, what is your secret sauce? What makes you different from others? I know a doula who does Reiki. I don't know if I'm saying it right, but a lot of you all do that. But I want to be able to add that to my repertoire, to the services that I add. You know, you never know who wants that sort of holistic based thing. Or on the other side, you have some people who want very medical very clinical backgrounds. So were you a biology student? I'd share that. Did you go to medical school? I'd share that. Maybe you have some people who want the exact opposite. They want to know, that you've been in a lab or two, so it's important to share what is specific to you. What's your secret sauce? And here we just have more beautiful work by an artist named Lauren that we'll talk about later, and a quote by Imani Dawson-Bay. We can go to the next slide. I won't really cover this in depth because if you look at this logo, it's pretty, this slide, it is pretty straightforward. And it's just talking about marketing yourself. You have to have a strategy for marketing yourself. Here it talks a lot about like logos and websites and business cards. And we are sort of revamping that too, because a lot of that is like online contact sharing too. So in our in-person, we talk about, other ways to share your information. But I'll use myself, for example. Again, it's not all about just the website and the digital marketing, right? I'm a person who doesn't like to use any of those things. So my marketing strategy and my plan around myself is a lot about the way I outreach to people and how many people I'm going to go to. And, a lot of my planning to market myself is in person. And there's a lot of ways to do that, but either way, you need a plan. It's not about just getting out there, and sitting at a table, because that is not enough when you're trying to support yourself and maybe a family on birth work. And then there's just some elements here to include in your website. This really seems really basic, but we've been to a lot of y'all's websites and we know that you're amazing and that you do amazing work, and it is very minimal. We're not learning anything about you there. So when you reach out to me and say, can you send me, refer people to me, and I send them your link and they click on it, they may not have a lot of time to dig and do a lot of homework on you. They want to see it all available on your site. I want to know your fees. A lot of times we really hide fees. I don't know why we do that. Sometimes it can be detrimental because now, you're saying, give me a call. That's what it says on the website. You got your number. I'm taking time out to call you. You're moving from the table, feeding your kids to talk to me. And then I find out that you are like $4,000 over my budget. So why did we even go there when I could just be going to someone else based on what is available there? So we have to really, respect ourselves and our clients by not trying to withhold too much information, and give them some of what they need when they approach your digital spaces, be it Instagram or however you interface. Next slide. So these are just more community voices. This is a sister from Sister Connection. But this particular slide is, I often say, if you don't look at the rest of the stuff, you can sort of look at slide 17 and get a good idea of a lot of what we'll talk about, because the best practices breaks down a lot of what the entire training is about. So it just really breaks down just key tips, key simple tips, but that can really help you navigate this space. So of course, like we said, identify what you provide, outline what your client is supposed to do. That is super important. A lot of times we have, these agreements and it's all about, what we'll do, but we don't have enough about what is expected from the client. And that's important because sometimes, we will see a client once or twice and they decide they aren't a good fit for us and we aren't a good fit for them because they were not aware that there's some expectations for them too, in the way in which you deliver your service. And maybe there is another birth worker who has different expectations that are more in line with what it is that you want to do. Specify a window in which you will be available and on call. When I tell y'all, scheduling is so important. We at the California Black Women's Health Project are the fiscal sponsor for a bunch of birth workers and some birth worker collectives. And what we hate to see and what pains us is that our sisters are running themselves ragged, sick, just tired from doing this work and allowing people to, being accessible to the community 24 hours a day. Being a community worker, being a healer, being somebody who is dedicated to Black women, Black mothers, Black people and children does not mean that you do it at the expense of yourself, does not mean that you are 100% available and that people can always call you at 3 o'clock in the morning. I don't remember who said this, but someone said, you'd be surprised how many emergencies happen during your office hours when you set them. So people will respect your time and make sure to reach out to you within your time, within your boundaries, if you create them. So we do talk a lot. We do a whole section on boundaries and really thinking about what are your, if y'all don't hear nothing else, what are your boundaries as a birth worker? We have lost CBOs, community-based organization leads, Black women. We lose our Black women gynos. We lose so many Black women and Black folks from not prioritizing creating boundaries. We don't need that. We don't want to save moms and babies at the expense of losing you. So that is very important. Thinking about fees, thinking about how long will you have a grace period for someone to pay their fees. The worst thing in the world is when you hear someone say, come with you with a very sad story, and you know that they can do nothing about their situation. But you have to think about that in advance. What do I do in these cases? Someone has a fire, something super tragic. Do I just say, watch my and say, sis, this is my gift to you because of your loss? Maybe so. Or maybe I say, in the instance of a tragedy or an emergency, you have 6 months to whatever to, pay your fees. So I don't mean to sound insensitive, but we also still have our homes and our mortgages and our rents. So always keep those things in mind. And so I won't go too much through the rest of this because there is a lot and we do need to move on, but you also want to end up talking about liability. You'll want to talk about HIPAA. How much can you share? Sometimes people are really open about what you share, and then one day you end up sharing something on Instagram or on Facebook and they're pissed about it, and you don't have any type of agreement with them that says that they were once okay with this. So just having all of that in there, and include a way for clients to verify what information is okay. So we're going to go to the next slide. This is just more about marketing tips and then tips to get your first clients. Talking about networking. What I know, and when we have our conversation with Audra after this presentation, is that in many of our programs, whether I worked in the Black Infant Health Program, the programs I work in now, I also work in youth sports. No type of networking does better for us than word of mouth. It is the most powerful marketing tool. And so that is really likely where you'll get your first client and where you want, in my opinion, where you would want to get your first client, because a word of mouth referral is typically very straightforward and honest about the experience because that person experienced it. So it's not from you saying, this is what I give. They will get to hear what a person received. And that is what they want to know. So it's always important to really document or even to ask, if you're working with somebody, to say, oh, I've worked with her. She's done so well assisting me. Like if you're doula and you've been working with a midwife, maybe even to have that midwife give you a review, or even, ask them, the midwife may ask, Raena's been working here with me as a doula. Would you mind also sharing how you feel about her so that she can share that and then get, and get my first client. So you really want to be able to do that. I know for me, one of my first clients was a friend. And so, I was very honest about the fact that this is my friend, but my friend was my first review. And that is how people would come to me after that. And then just really work any circles you have, be they church, be it social media, use your hashtags, use those paid ads. They really work to just get your name out there in the geographical locations and amongst the target area that you're looking at. So that's pretty basic information, but just kind of a confirmation. Next slides. This is also a thing that we spend time on in our training. We do a cute little fun little exercise around your elevator pitch. Just like any business, you want to be able to tell people in 30 seconds what it is you do, what you provide, and why your service is unique. And so we really take time to think about that. We usually do it right after the branding portion. So you really you think about what brings me to this work. What's my special sauce? Who do I want to help? You think to have all that in your mind, and you really shrink that into a 30-second elevator pitch that you can share with a person, because sometimes you don't have a lot of time to share this, and you want to be able to do it pretty quickly. For example, we're going to the Black Mamas Matter conference this weekend. This would be something where you would want that 30-second pitch. Even if you're talking to other birth workers and want them to know who you are, that is always helpful for you. Funders, you never know who you meet in the street, might have $1 or two. Even us, at the California Black Women's Health Project, we have money to support birth workers, and people come to us all the time. And, that 30-second beginning situation is really important for us. That's where we catch your vibe, along with the information that you provide. And then one of our sisters, Selah, that was just a quote from her. I think we're going to kind of skip this part because I think we've all done a very good job. We created this a little closer to the beginning of the pandemic, so people were still figuring out, how to navigate the virtual environment. I think at this point, we've pretty much mastered in a way this virtual environment, but we do a little bit of help in our longer sessions around using Constant Contact and MailChimp, which are sort of like e-blast, sort of e-community communication points. We do show how you can do some special things around Zoom. Like, for example, if I had a little issue with my computer, but if I didn't, you would see my slides big and you'd see my little face right in the corner of the slides as a part of the slides. And that's something that MacBooks and some other programs can do. So we just teach you ways to be more interactive with your online or with your virtual community. So we'll go to the next slide. This is another one that takes a little bit longer to dig deep into, but we do definitely talk about financial planning. We see this a lot, whether it's birth workers or it's people who want to start a nonprofit, and you just letting that little heart just lead you right on to spending every dollar in your pocket, going broke or at least struggling too hard, just throwing a lot of money into something and not really having a plan developed. So here we just really help you to think about what is it going to cost for you to do your business. And a lot of the things we talked about earlier feed into this, right? So for example, I talked about maybe I decide that I want to specifically do birth work to support foster youth, right? So maybe I go to a transitional and youth authority office and see if there's grant funding there. Some of these areas in which you give do your services, you may get grant funding through. You may say, I want to connect to a Blue Shield or a county or some type of program. Or you may say, no, I need to do this thing for myself. I'm going to crowdfund. So how do I use GoFundMe? How do I use other sites that help me raise money like that? How do I best use GoFundMe? People make fun of GoFundMe sometimes, but I've seen serious fundraising be done on GoFundMe when it's done properly. So there are many different ways in which you can start up your business, but the worst way to do that is to just start throwing money out of your own pocket. And I will add to that, another thing that we stress in this presentation is that you do not want to mix your personal money with your business money. When you decide that I'm doing birth work as a business, it needs its own business account. We talk about that in this training. It's not that hard to set up a business account. A lot of times they'll throw you a little extra $500, $200, maybe $1,000 just to open up a business account. So it's not hard to do, and you really want to separate that money, because sometimes you won't even know that that business is not bringing in enough money, and because you can't see it, it's not clear, and you really want to know what it is your business is doing, especially if you end up needing help, if you get audited. We talk about auditing processes, etc. So this is one of the more technical business financial portions of our training that we do. We talk about the credit. We break down credit a little bit more, what you're going to be asked when you try to get business credit or business loans, or even just credit cards on your own to support your business. You need to understand capital, collateral, capacity, conditions, and understand the way creditors view you. So creditors create a character for you. Even though your online profile doesn't speak to who you are at heart, it's the character in which they see you. And it's how they judge whether you're a trustworthy borrower and how much money they're going to give you. So we also talk about how do you build a financial character, right? Aside from who you personally are, because that is important, and it will affect if you're able to borrow money or get credit, etc. Next slide, please. And then we just talk about more strategies, especially pricing. Again, for our sisters. Y'all are just beautiful beings, and you just want to help everyone. But you have to have a price. You have to have a scale, and it can be a sliding scale. And we use here LA County's base pay for doulas as sort of just a base. It should always be higher. So I am pleased on the record that we are not saying $1,850 is the standard. We're just saying this is pretty much the highest I'd say that like maybe agencies are paying doulas, at least in this county. And so we say use this as a base to think about what you want your services to be. And then we also talk about how this is just to do those 3 prenatal visits, 2 hours each, 3 post visits, 2 hours each, and then participation in birth. So some of y'all are doing that, plus Reiki, plus tarot reads, plus yoga, plus placenta encapsulation, and you're not making each of those things an add-on service. So we don't want you to be giving your doula services or, your midwifery services or your lactation services and doing all of these extra things and not attaching a cost to it. Again, if you decide you want to do some heart work, some, free work or some donation work, fine, but you still have to calculate that for yourself and your business. I spent these hours doing this free work. This is what that amount of money should have been or would have been. So do I go take on more clients to offset that? I just have to be aware of where money is coming in and out and set those boundaries around pricing. And then monetizing your business. Honestly, a lot of folks, unless you have you have staff or maybe you've got a bigger business, may not be using a lot like a bookkeeper. You may not even use QuickBooks, but you, like I said before, you must open a business bank account. You should always have every single pay method that a person can pay you with. Because folks will be like, oh girl, my PayPal's down. All right, then give me Cash App. Oh, my Cash App. All right, I'll take Venmo. I got everything you got to give me money, right? So always have all of those. We even say, even get the Square. People be like, I don't really swipe a card no more. You never know. The whole grid could go down and the banks may not have, who knows? But you always want to have every single way to get paid that you can when you're, you have to monetize your business if that is what you're looking to do and it is not a hobby for you, just a hobby for you. Compliance, this is more technical information. If you're watching this, please do go ahead and just go Google Assembly Bill 5, the Gig Workers Bill. It breaks down a lot of the requirements around being classified as an independent contractor. So if you are working with a health provider or a county agency, or even, if you sign on to do Medi-Cal or whatever it is you're doing, it is very important to understand your rights, requirements, et cetera, around being an independent contractor. You must understand if you have a business about your tax filings. They will come after you. They need their money. And so here we just break down some different taxes in California and the local taxes. I talked to you earlier about auditing. It's super important. A lot of times you may not be audited, but like if you have a nonprofit, you would want to just audit yourself and have that because you will get a lot of grantors and people who want to give you money who want to see that somebody else is watching your books and it's just not you. They want to make sure that their money is going to be spent, providing these birth services. And then lastly, you have to really look at HIPAA compliancy, and there's some information on Doula, and then where you can really find more information about reimbursements with insurance providers, et cetera. And again, if you have those type of questions, we fully fleshed out in our trainings. So yeah, we're pretty much to the end here. You can just, when you receive this, because this is shareable, you can click on these links to find information on additional resources. The California Black Women's Health Project, we are here for you as a resource. That is the basis of what we do right now, supporting Black birth workers. So always reach out to us. And the thank yous and of acknowledgements. We did not do this on our own. We would not pretend that we did. So you'll see a bunch of different doulas here: Divinity, Angel, Michelle, Felicia, just a bunch of people, and Auntie Lo, who's heavily involved in the AIM program. And then again, we just just want to end by thanking our funder who funds this work around the toolkit, and that's the California Healthcare Foundation. So I breezed through that thing like a mad person, but I just wanted to give you the best intro, the best sort of flow through that I could. And yeah, let's talk, Sister Audra.
Well, round of applause for you, Raena. You did breeze through that. You did such a fabulous job of sharing the work of the Black Birthworker Toolkit. It was very exciting to see just all of the depth that went into that from your organization, and very exciting to see. I know it was published last year in June, so it's been actively available for folks, and it can be found on your website. But I think like some of the questions or comments I had, like, I think this is a toolkit that, though we're talking about for Black birth workers, it can really be used in other spaces with folks, because it gives folks like really kind of some of the foundational principles for starting a business, for working their business, for creating their not just their branding, their strategy, their name. You know, you talked about so much, so I'm going to kind of like go through some of the stuff. I heard you giving the sisters, and I should say brothers and folks, some tips, because there are some dudes that are now, I don't know if they want to call them doulas or what do they call them, but there are some male doulas in the work too. So I think it's critical, the information that you share. What really prompted, do you recall what prompted the creation of this document or this toolkit?
Absolutely. So before I got to the California Black Women's Health Project, you had, you know, our sisters, Natalie, Dana, and Sonia working there, Natalie Champion and Dana Sherrod, along with Sonia Dom. And they've always had this focus to support birth workers and organizations. That's always been something that's been at the heart and core of California Black Women's Health Project. And as we talked to different birth workers, what we noticed is that doulas specifically, so of course we're talking about all birth workers, and I hate to always focus on doulas, but in this instance we will, because doulas specifically got really popular really fast. You were seeing it on shows, you were hearing people say they got them, you were seeing providers offer pilot programs, and all of a sudden, you know, we had this entity and we had this workforce, and people were saying, let's train them to help families and throw them out there. Right. So we would meet them and we would see all of these different things. Like I mentioned, folks getting calls around the clock, coming into our meetings dead tired, right. Calling saying, you know, I need some work or I need some financial assistance. And we'd be like, okay, well, do you need a job? Oh no, I'm a doula, but I'm right. I'm having a hard time. So we were like, wow, you know, we cannot have this. We cannot have a workforce that is helping to protect and save our families and letting themselves go to the wayside. And even for examples that aren't that dramatic, right? You just had people that were out there who were actually thriving. And we were like, this group of people can inform this other group, right? We got to put our birth workers who are doing well, thriving, making money, getting their name out there and helping our community, which is the whole purpose. And so what can we take from what we learned from them, put together and share with the rest of the workforce?
Right. So you're absolutely right. It almost seemed like somewhat, I don't want to say it was a craze or a fad, but it just really began to spread more. But I want to say in the sense, I mean, because many of us know, you know, you've been around in the work through Great Beginnings for Black Babies, and then with Black Women for Wellness, and now with the California Black Women's Health Project and Perinatal Equity Initiative. So you've been around this work in advocacy and work for Black maternal infant health. I want to say we just might have just gotten tired of having to seek out the services from others and not having the part or the ability to be able to provide that ourselves to our community, knowing that this is something that has been done for generations and passed down. And you're finding when you work with folks, like I could bring up Carefree, who's, you know, she comes from a family of, you know, birth workers, right? So I want to just kind of at least highlight that. I think that was part of it. It's not a trendy thing, but a, beneficial need, a right now service that was, very much needed. And then I think it also allowed for those who were doing the work, like you said, like, sis, you're not getting paid, to really now be able to elevate the work that they have been doing for decades. I remember when Felicia Francis Edwards was sharing her story, and she was sharing that she was Andrea's doula. And I'm like, Andrea's sons are grown. So you've been doing this for almost, like 2 decades. I mean, come on, sis. Like, what's really going on? So I think that your point is well taken there. I think with that in mind, you put out business description, business target, formation of the legal product, service, and brand. What of all that have you all been finding out? What is the most difficult for doulas or birth workers, or challenges around, maybe putting the toolkit into practice, or even before they get to the toolkit? What has been the most difficult that we should be like, okay, here, let's talk about this and see how we can support?
I think, and at first, I just want to thank you for clarifying that, because it was very important for you to say that. We are very clear that this is legacy work. Ain't nothing new, ain't nothing trendy about what we do. It's just that other folks that are trending on to actually supporting and investing in us. So thank you for clarifying that. And then I will say, I think in working with birth workers right now, I think what we find is most difficult is people are already on the ground helping families. So it is very difficult to pull back and take the time to learn, just to sit down and read all of this, and that's what we kind of want to do with this, because you got to sit down and really read that information about starting your business. You're a businesswoman and a realtor, what that takes. That's a lot of paperwork. That's kind of one of the main things we want to do. And we work with a financial institution as well. So we work with a Black-led, Caribbean-led financial group who comes and works with us so that we can really make some of that information plain. A lot of it is very confusing. I would say the documentation is a number one barrier. Even if it's not confusing, you're the smartest, most business acumen person in the world. It is the time. The time that it takes when you've already got clients and you've already got children. And a lot of our birth workers have other jobs. So they have a full-time birth working in that. And for us to just be able to sit with them and sit them down and give them this information, we want to be able to extract the good stuff because they just don't have the time. So I think I would say the paperwork, and I already, we're already thinking about what that means around Medi-Cal. Because
that's my next question. Yeah.
People are going to need that. So we are we are talking to our partners and our stakeholders and even our funders about how are we going to support these birth workers. We need some investment now so that we can actually take them and give them assistance to get that paperwork done. It is not easy. I remember even being at Black Women for Wellness, we had to help people with paperwork just to do their taxes when they had more sticky tax situations, right?
Right.
If that is difficult for people to do, and that information, those websites are all crazy. Imagine what that's going to be like when our birth workers got to deal with these doula cow.
That's so tiny, doula cow, right? That's like what it's going to feel like, doula cow. Right?
That's branding. That's branding right there. So what happened with this California doula cow? We're going to really need to seriously support because listen, I am still wrapping my head around what this means, what it's going to look like. It is, like you said, I've been around for a while, dealt with policy, dealt with contracts and everything, and I'm still confused about.
I think that might be one of the biggest challenges, because it is that documentation. You're going to have to track, you have to do your intake forms, you got to track your number of visits. You got to have your billing down. So it was probably simpler when folks were like, running their business on their own, just getting these clients, meeting folks and setting their, their rate, right? Or modifying their rate. Now you're going to be at a given rate, and you're going to have the tracking and support. And yeah, you're right. There's lots of conversations around that. And I want to say the toolkit will definitely be a benefit. Do you all plan on, having maybe like a toolkit, not 2.0, but just like an addendum to the toolkit around the Medi-Cal, the implementation of Medi-Cal for doula services in California?
So we are asking funders and partners right now to help us staff that.
Okay.
Because it's going to be important. But even if we don't, so I'm not going to make it seem like we just need funding. We're definitely going to figure out some way to provide a resource around that. I can't say that it will be something fully fleshed out like this was, where it's like a whole document and there's a supplemental training that goes with it. It may not be all that. It might be a 1 or 2 pager, but we will be having some type of, visual plus support around figuring out reimbursement.
Thank you for that. Do you feel like it's going to be, impactful to their business, like in a more positive way, or it's going to take some time, or there's going to be a challenge for them to keep doing the work?
I think it is going to be an individual experience. I also feel a little reluctant to speak on it just because I'm not doing any direct service work right now like others are. So I know that it is going to impact them differently. So I do know some people who do not have the capacity to be doing outreach, to be doing flyers and doing so. I know birth workers who are personally very happy about this and waiting for it and wanting to be able to plug into those programs and get clients that way. But that also doesn't mean it's going to happen that way. It doesn't mean just because you are Medi-Cal reimbursed that you won't still have to do that work. But it does assist and it does help because there will be a larger pool of people who will be able to compensate you for these services. So that's in one space where I think it is helpful. In a way that I feel like it may be, and I'm so appreciative and thankful to all the birth workers who are working on this. They are making sure that this doesn't become a way to create another class of working poor people. I'm really concerned.
Oh yeah, I can tell you there are some queens and folks behind the scenes that are working diligently. I've been in several of those meetings. I go as I can, and I take my hat off to those that are consistently staying the course because it is a lot of work. It's a heavy lift. I'm hearing what you're saying. Excuse me, and I reflect back a little bit when I was a perinatal health educator. But again, I didn't have to probably do as much outreach because it was set up in a sense where they were the client was going to meet me anyway as a part of the team within BIH. They would meet with the community health worker, they'd meet with the nurse, and they'd meet with me. Or I'd have this session of classes set up. So they would, hey, this is what you go through this series. At the end, you get these gifts, this car seat, this stroller, this whatnot. But when I think about it in this time, I think like, yeah, how beneficial could the toolkit be? And then the other piece is like you're mentioning, looking around the funding options. So I would say, hey, if you haven't, bring it back up to those that are in the work and those that are about to embark on is the toolkit. I just like really seeing how that reimbursement will impact their business.
Absolutely.
Right? And is it a conversation for them to have like, yes, I want to be one of the ones that is doing Medi-Cal reimbursement and providing the service, or I want to stick to my private, non-public, business. So,
and there are a lot of people who will stick to that for a lot of reasons, Absolutely. And I even about that too, like, it's so good. I'm just going to be honest, for us to have all these agencies and providers that are creating ways for doulas to get it plug in and serve, but that's not going to be for everybody. You have to know yourself. If you are not that, very, if you can't interface with government agencies and things, be honest about that. And we need everybody, every type of birth worker. So
right. I think that's good. And I think, like I say, we will, continue to share and talk about the whole toolkit again. So, and bring that back up to light. You said a couple things. What I want to go back really quick. Like, is there, okay, cool. Is there any easy part to this as you see this for the doulas? As you look at this toolkit, what do you think like is the simplest thing for them to do, or that you've seen in them?
I would say the simplest, and I don't even know if I would just call it simple, but I would say is really creating your boundaries and your monetization of this work. Because the easiest thing to do, right? You may not go, let's just be honest, you may not go get the business account and do all this. You might just separate 2 different bank accounts, get your Cash App and let it come through there. But if you can really take the time to say, these are my hours, let me really think about my pay scale. Let me really think about what services do I provide. Let me look at this landscape and say, maybe I'm not that far from the Inland Empire, so maybe I should go here and do a little more. I'm not that far from San Diego, so maybe I do want to provide some services. Being able to do that, I think, is something that we do see a lot of birth workers do once they take the time and pull back from the day-to-day support and really look inside themselves and what they want out of this work or what they want for themselves in their lives. I think that is a part of what we do here, and that's really important because, you know, at our organization, we're about mental health. We're about the whole health of the person. So sometimes this birth worker toolkit will do nothing but make a person pause and say, do I want to be doing this way? You know, how can I do it differently? How can I scale this up, or how can I scale this down? You know, it puts it into it really shows you what it's going to take and make you make that decision of how you want to go about doing it. And we watch people be able to do that once they interact with the kid.
I think that, you know, I want to say, I don't just think that, I know that that's great. I think that even in the toolkit, one of the things I like, because I think people have to be mindful, like the birth code of conduct, right? You talked about like no is a complete sentence, not arguing, not debating. I think these are great aspects because a lot of times we have to be mindful in these spaces to not interject, right? Or put what we want or what we would do ourselves. We can provide recommendations, but we cannot push off what we want. And, you know, I know some of us, you know, we've been Black and we've been Blackly Black, right? That's how people sometimes would define it. We, you know, we didn't come with not just the afros, we didn't come with the Afro pick, you know, we have come from, you know, this lineage of freedom fighters and writers and things of that nature. But I think that's another thing that is helpful when we're looking at how we build out our brand and business. Mm-hmm. So that, you know, I just go by what the old folks used to say. Tell me if you've heard this. You catch more flies with
honey
than right, with vinegar. So I know a lot of times we want to go into these spaces and we just like, fine, I'm gonna get on that nurse, I'm gonna get on that doctor. But how this toolkit may also help in ways of communication, because remember, like you shared, you're your own walking billboard, right? So other people are watching, and you could come across some nurses that don't have the capacity, or medical providers that don't have the capacity to do what doulas do, and they're not interested in doing that, and will say, you know what, I met a great person, and I saw how he or she or they worked with these clients or one of my patients, and I would refer this person to them. So I think that, you know, I like that in what you shared in the marketing tips and also in the birth code of conduct. Competition. What do you think competition-wise?
I think that, like we said, it's just important to look at the landscape and to see the landscape as a resource for you, not something to scare you, not as something you think needs to make you more competitive or, you know, put your gloves on and be ready to fight for your clients. But more so understanding what's around you. A lot of times folks need backups. Like, you know, so I may start be looking in the community and I find that there's somebody right up the street. Well, maybe I want to connect with that sister and she becomes my backup, or somebody who, you know, I refer to if, like, you know, I'm gonna be out of town, or I'm, you know, about to have my own baby and I need time off. So the competition is not always a bad thing, but it is something to be aware of. And it is something that may, if you have this as a business, you may need to pivot. You know, you may need to figure something else out. You know, like I said, you know, if I'm sitting right here up underneath Kindred Space and Crimson midwifery, and I got them powerhouses, I'm not about to sit my thing right up in the middle of South LA, because that doesn't make sense.
Right. I think you're
in that same space. You know what I mean?
Right. I'm glad you brought up midwifery, because we didn't go into that after we talked about doulas, because we are the Black Doula Consortium, but we also are, you know, very keen on celebrating and supporting all of the aspects of birth work. So even midwives, this is key and essential. Even lactation education specialists, you know, we have, like you mentioned, Kim and the Black Birthworkers Kindred Spaces, but, you know, there's still room for more birthing centers. Like, you know, it would be good for folks to get connected. I think you mentioned that about these connections, and as you said it, you know, partnership. Partnership is key, and a lot of times, you know, that's biblical. I go back to biblical, two are better than one, right? Because if one falls down, then the other, you know, but not just that, in partnership, and I love how you shared about the burnout. Do not, like, it's no sense of, you cannot pour from an empty vessel, right? So that partnership is key to that vessel. And like, I love how Carefree and Saida linked up and created, you know, the Frontline Doulas, and they have diversity uplift. And then they're also the Sankofa birth workers for those in the IE, you know, that is Dr. Saida and Deidre and those group of birth workers. And then you have others. So folks could look at it, you know, it's not, don't always see it as a competitive market, see it as an opportunity, because there's still more, even if you could have a collective of birth workers that have come together in a region. Like, we know for certain, like, I'll pause here and ask you to share some of the other regions that could benefit from more birth workers.
Listen, I mean, the Central Valley and Central California is a shout out to our sister Selah, sister Selah, Crown Selah, who is in the Central Valley and California Black Women's Health Project, is supporting her work, because that sister goes between, and this is what I was saying about what are you willing to do? That sister goes between the Bay back to the Central Valley to that support. So just and I'm not telling you to do that, but just a little spread out. Bakersfield, a lot of us are moving out to the areas of Bakersfield, County, we're seeing a lot of folks in Menifee. You'll be surprised, but we are getting a Black community in Menifee because costs are too high here in LA. So there are many other regions who can really use the support. And just depending on how much outreach you want to do, there are little pockets that get ignored that are even a little bit closer in. Just dip into that they're kind of hiding in there, like North Hollywood.
Right. You can look at, you know, Black Infant Health. You can look at the Black Infant Health program across the state and also look at the data. Like, if you pulled up the data, you would know Alameda County, some folks don't realize, like, Alameda County has high rates of infant and maternal, as well as Fresno, you know, those places, like you mentioned in the Central Valley. Orange County has a need. We have people reaching out from as far as Orange County. The other I was going to share, you mentioned North Hollywood. We were just looking at some of the data by spa of birth in there and saw that, like, in ranking, spa 2 was like spa 6, spa 8, then spa 1, and then spa 2 had the most births. And then, you know, we have spa 3 coming in number 5. So most Black births, that's how it ranks on who was having the most births where. And so if you start to, like you're sharing, look at the data, and then you'll know, like, as your marketing opportunity, here's your field. Like you share, I love it how you share that, and then see who's doing some work there. One thing I can say about this group of the Black Doula Consortium, I have to take my hat off to my sisters in this work, Shantae Davies Balch, as well as Kata, who's behind the scenes always, but has such a powerhouse with the Black Wellness and Prosperity Center, because they are putting out great content and doing great work. I took my dad to visit with them in Fresno when we had to go up there on some other family business. And let me tell you, proud of those folks. So check, that's what I would say, look at where these toolkits go. Last thing I'll wrap up with this is additional resources. What can you say about that? I really like that you all had that in there.
Yeah, so one of the easiest things to do, especially in this virtual landscape, is that's why we included all those links. Start there. There is so much information online, so we absolutely always encourage people to start at those links. We have even more links on our website in our maternal reproductive health page that just has all type of links to resources that you need. And from there, I always tell people we do serve as a resource. So from there, if you feel like I clicked on this, I don't really know who to talk to, or I called this number, I don't, always come back to us, or you can all go to AIM and your community action teams. There's all these people who can, make sure you are redirected to the right place. Like I said, we have financial folks that we can connect you to, business folks that we can connect you to, but if there's something that's not there, we have a network and we'll reach out to those folks as well. So yeah, I always say, start with the links. You can start with our website. You got, website, you got different folks. You mentioned Alameda County, made me think about Beloved Birth because I love them so much. Sister Taisha Warren and them, all these people that you can tap into have a plethora of resources in your available to you, and I'd be glad to help you walk through that if you don't know where to start.
So look, folks, that was absolutely perfect. And as we wrap up, I think you shared some great points that, even though we're talking about what's happening in Los Angeles and California that's originated here, this toolkit can be used nationally. It can be used internationally because, for anybody in birth work spaces, they can look at what is needed and, apply that to the work that they're doing. So I love that this has happened. I want to thank Sonia Young-Adam, your executive director, even for the thought and the partnership that you guys have had with, me in the LA County work within AIM, but then also being able to broadly share this. One thing I want to say, and then I'll let you close out, is I love this piece by our sister friend and colleague from LA County, the Black Infant Health Program Coordinator, Miss Yolanda Rogers-Jones, where you have this piece on community voices that says, reaching a state of equity is not easy. There will be difficulty and even pain, but if you really want to see the power of equity unleashed, then work for unity. And I believe that is clearly what is done in this piece, this toolkit here, is it's working for unity. It is not establishing any big I's and little U's, but it's a strong push for unity in the work around Black birth workers. So Raena, thank you again. Any closing, parting?
No, I think our sister Yolanda closed it out and took it out. And if you all read that toolkit, please do take time to look at those beautiful, inspirational, and level setting community voice quotes that are every few pages. They're beautiful and they're inspiring as we trudge along with our four mothers' work.
I'm so thankful for that. I looked back and saw all the key players who were a part of it. And I was very, excited to see Yolanda, Auntie Lo, some of the folks you had in this work that helped put this together. Arnetta Mack, I worked with her, we know SCLC. So there's so much just being done. Folks, again, get a Black Birthworkers Biz Toolkit. We will make sure to drop the actual place where you can find it on the California Black Women's Health Project website. Though it says 2021 when it was published, it can be used now and well beyond. So again, thank you, Raena, for being our guest and being present on today. The Black Doula Consortium appreciates and thanks you very much. Have a great one, everyone.
Bye.
Bye-bye.